A second COVID-19 booster shot is now available for some people. I spoke with medical expert Dr. Daniel Varga about who should get the shot. As we continue on the road to recovery from the coronavirus pandemic, there's a new medical decision some of us need to make. Is it time to get a second COVID-19 booster shot?
Now that we have this booster, this second booster available, this is the suit of armor. We're asking New Yorkers to suit up in. We have a great number of people who have the first dose, second dose. Only 57% of New Yorkers have had a booster, the first booster. We encourage them to get them because they're not eligible for the second booster for 4 more months. So this is what the message I wanted to deliver today, that we're still not through this. We're doing the best we can with the resources we have and encourage people to take this still seriously.
On Monday, Governor Kathy Hochul led by example, getting her second Pfizer booster shot. She urged New Yorkers who are eligible to do the same. Now, if you're 50 years old, immunocompromised, or received the Johnson & Johnson vaccine, you can roll up your sleeve now, too. But should you? That is the big question. And what should your second booster strategy be? We asked Dr. Daniel Varga to weigh in. He is the Chief Physician Executive at Hackensack Meridian Health in New Jersey and a medical expert that we've consulted many times throughout the pandemic. Dr. Welcome back. Thanks for taking a few minutes for us.
My pleasure.
What's your advice? Again, this is only for people over 50, immunocompromised, and people who got the J&J vaccine. But what would you advise at this point?
You know, I think the biggest thing that I would advise right now is for everybody to really take a look at what the recommendations are, have a conversation with your attending physician. And, I have a predisposition to saying, the vaccine is incredibly safe, it's incredibly effective, and I've already had my 4th shot. So, I think there's a strong argument to be made for people to go ahead and get the vaccine.
And, cases are low right now. We keep seeing there's a slight uptick. There is that new variant that is out there, bigger problem in Europe than it is here right now. So do people, I guess, that have had their first booster, are they sitting at home saying to themselves, hey, I should probably go get that right now? Or can they kind of sit back and wait to see if there's an uptick?
I think that right now, if you look at somebody who's actually had their 3 shots, they're in pretty good shape. The vaccine is strong, still works. But the one thing that we definitely see is that there's a decrement in antibody levels over a period of time. One of the things that really informs my decision right now is that when we looked at our team members during this last surge, the Omicron surge, what we found is breakthrough infections almost all occurred in people who were more than 4 months out from their initial vaccine series and or more than 4 months out from their booster series. So I think the answer to the question is, immunity wanes with what we know right now.
And let me ask you, let's say getting it now, waiting a month or 2, do you see in the fall people potentially needing then a 5th shot?
Yeah, I think that's going to be the thing that we'll get a better understanding of over time. 2 things that'll play out there. Number 1, actually watching what happens with immunity levels after the 4th shot, number 1. And number 2 will be watching what type of, if any, variants tend to emerge and how those are affected by the existing vaccine regimens that we have.
I want to ask you a couple of quick questions about kids. We're getting closer to vaccines being available for the 4 and under crowd out there, those kids that are not vaccinated at this point. Also, you've seen here in New York City, at least, kids under the age of 5 being mask mandated once again. Some kids, depending on the school district and where you are in the tri-state area, kids are now with masks or without masks. Just your thoughts on that real quick. Let's start with the infant vaccine. How close do you feel we are to that?
I really don't know how close we are to that. I do know that, for the younger kids, they tend to tolerate being infected with COVID, very, very well. The big concern we have with the young ones is really their ability to be a vector to more vulnerable people, like older folks who are not vaccinated, even older folks who are vaccinated but haven't been boosted, et cetera. So, that's going to be a challenging scenario because across the board, we've got this, we've got a vaccine that isn't specifically tailored like the flu shot is. But in the little kids, I can understand folks' reticence around that because they tend to not get terribly sick with it. But again, it's more the concern of if they have vulnerable people in their families, in their households that they're in contact with regularly. That's probably the cohort that I'm most prone to really advocate for getting a vaccination.
And as far as kids with the mask, you think it's been a safer play to keep the kids in mask as long as possible before actually you hear about the mental health issues, other side effects of the kids wearing masks. But if it keeps them safe, I guess it's kind of hard to argue that.
Masking in general, if everybody's doing it and we're all just simply wearing a good surgical mask, we are protecting each other in that setting. I think the real question is, are kids transmitting it back and forth to each other really putting kids at risk? The data would say they don't get that sick with. But again, the issue here is if you go home and your mom is a diabetic, or you go home and your dad is a severe asthmatic, and they get sick with it, that becomes a big deal. So I think there's still going to be an ongoing conversation about young people and the value of vaccine, and where it really has its positive impact. It clearly is helpful in trying to keep kids from being real sick and transmitting the disease to folks who are more vulnerable than they are.
And final question for you, as a medical professional and as a doctor who has kind of sat through this pandemic and watched the highs and the lows, when you see people rushing to get back to normal, you see crowded airports, you see what's happening in Europe right now, or even in Shanghai being in a total lockdown, when people kind of see the summer months approaching, are you at all kind of like, let's just kind of pump the brakes a little bit and take this week by week rather than thinking we are fully back to normal right now?
Yeah, I think that as we go forward, we really do have to keep a look, and a really close look on the community prevalence. What's happening in the community should absolutely dictate what we do. That's the way we've set up our infection prevention procedures and everything in our hospitals. It's all based on community prevalence. If it's starting to get high, we decrease the availability of visitation. We have our folks go to higher levels of PPE and a whole host of other things. When the community prevalence is low, we kind of throttle back a little bit. So yeah, absolutely, we've got to watch what's going on in the community.
Sounds like the approach is a heck of a lot different than it was 2 years ago, which is a great sign. And Doctor, we thank you for taking the time, and thank you for being with us throughout this pandemic the last couple of years. We really appreciate your insight. Dr. Daniel Varga, Chief Physician Executive at Hackensack Meridian Health, thanks again for helping us sort this out. And if you'd like more information about COVID-19 booster shots, just go to our website, cbsnewyork.com.